What do you know about tuberculosis? A deadly disease that has been with us since the dawn of humanity, tuberculosis, or TB, is still a major health concern worldwide. This relentless bacterium primarily targets our lungs, but don't be fooled, it can spread to other parts of the body too. With a history as old as civilization itself and an impact felt across the globe, TB's relevance in our world today is undeniable. So now that you know what tuberculosis is, let's delve into its causes and how it is transmitted. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis. But how does it spread from one person to another? This is a question that has intrigued scientists for years. The answer lies in the very nature of the disease. Tuberculosis is an airborne disease. This means it spreads through the air, much like the common cold or flu. Imagine a person with active tuberculosis. When they cough, sneeze, or even speak, tiny droplets containing the tuberculosis bacteria are expelled into the air. These microscopic droplets can linger, and if another person inhales them, they too can become infected. However, it's important to understand that not everyone infected with the tuberculosis bacteria becomes sick. In many cases, the body's immune system can contain the bacteria, resulting in a state known as latent tuberculosis. In this state, the person is not sick, nor can they spread the disease. But the bacteria remain dormant in the body and could become active in the future. Knowing how TB is transmitted is just the first step. Recognizing the symptoms is equally crucial. If someone is infected with TB, what signs should they look out for, and how is TB diagnosed? Tuberculosis often starts subtly with symptoms that may be easily mistaken for other health conditions. The most common signs include a persistent cough that lasts 3 weeks or longer, chest pain, or pain with breathing or coughing. Other symptoms to watch out for include unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite. When it comes to diagnosis, the first step is usually a skin test, also known as the Mantoux tuberculin test. This involves injecting a small amount of fluid called tuberculin into the skin of the lower arm. If a hard red bump develops, it could indicate TB infection. A blood test can also be utilized for diagnosis. This measures how the immune system reacts to the bacteria that cause TB. Once diagnosed, it's crucial to start treatment promptly. But what does TB treatment entail? Getting diagnosed with TB is daunting, but with the right treatment and management, it can be cured. Tuberculosis, a formidable foe, is tamed by a meticulous approach to treatment. The standard protocol typically involves a cocktail of several drugs taken over a period of 6 to 9 months. This might seem like a long haul, but it's a necessary journey on the road to recovery. One of the key players in this treatment regimen is a drug called isoniazid, often coupled with rifampin, ethambutol, and pyrazinamide. Together, these medications form the backbone of the fight against TB. But remember, the battle is only won when the war is over. It's crucial that the treatment is completed in full, even if the symptoms have disappeared. Premature discontinuation can lead to drug resistance, a formidable barrier to cure. In dealing with TB, a comprehensive approach is essential. It's not just about treating the disease, but also managing it effectively. Treatment is one aspect, but how can we prevent TB in the first place? Prevention is better than cure, a saying that holds true for tuberculosis. The BCG vaccine administered in infancy is our first line of defense against this disease. But let's not forget the significance of everyday measures. Good ventilation in living and working spaces, along with wearing masks in high-risk areas, can significantly reduce transmission. These simple steps, paired with immunization, can make a world of difference in containing and preventing tuberculosis. Remember, knowledge is power. The more you know about tuberculosis, the better equipped you'll be to fight it. So, we've covered a lot of ground today, from understanding what tuberculosis is to its symptoms, diagnosis, treatment, and prevention. We've delved into the causes and how it's transmitted, underlining the importance of early detection. We've highlighted the common symptoms and explained how a diagnosis is made. We also discussed the various treatment options and management strategies, stressing the importance of adherence to prescribed medication. which includes drugs like isoniazid, rifampin, ethambutol, and pyrazinamide, among others. For drug-resistant TB, we've got bedaquiline, linezolid, moxifloxacin, levofloxacin, and amikacin. We've also shed light on the preventative measures, particularly the BCG vaccine, and the significance of following these steps. Finally, we've shared some real-life stories to illustrate the impact of this disease and debunked common myths. Remember, knowledge is power, and staying informed is the first step towards prevention and effective management. And that wraps up our discussion on tuberculosis. Stay informed, stay healthy.